When you hear the word lymphedema, most of us probably just picture swelling in an arm or a leg. But it's so, so much more than that. We're talking about a really complex, progressive disease that's driven by a kind of runaway chain reaction inside the body. So let's dive in and really crack how this vicious circle works. This quote from Dr. Stanley Roxon just hits the nail on the head. Inexplicably underappreciated. For decades, lymphedema has kind of been sitting in the shadows of medicine, which is why most of us haven't heard much about it. But that's all changing. Thanks to an absolute explosion in research, scientists are finally starting to understand and, more importantly, fight this disease. All right, so here's our game plan for this explainer. First, we're going to get a handle on just how big this underappreciated disease is. Then we'll look at what kicks it off, the initial trigger. After that, we'll unpack the vicious circle that's at the very heart of it. We'll see how new tech is letting us actually watch the damage happen, explore how we can break that cycle, and finally, zoom out to see how this is changing our view of the entire lymphatic system. Okay, so let's start there. Just how big of a deal is this quote-unquote underappreciated problem really? Let's take a look at the actual scale. First thing to get straight, this is not just simple swelling. Think of it more like a domino effect. It all starts when your body's internal drainage network, that's the lymphatic system, gets blocked or damaged. That blockage triggers this chronic, low-grade inflammation that just never shuts off. And that inflammation leads to a buildup of fat and this tough, scar-like tissue called fibrosis, which, you guessed it, makes the whole condition even worse over time. And we're not talking about a small number of people here. The scale is, well, it's massive. An estimated 200 million people around the globe are dealing with what's known as secondary lymphedema. So no, this isn't some rare, obscure condition. It's a global health issue that's been flying under the radar for way too long. With numbers that big, it's about time the scientific community started paying attention. And they are. Just look at this chart. The number of scientific papers on lymphedema more than doubled in the last decade alone. This isn't just a small increase, it's an explosive growth in our understanding, and it signals a brand new era of hope for patients. Now, you should know, the disease basically comes in two main flavors. There's primary lymphedema, which is caused by a genetic fluke. It's pretty rare. The one we're going to focus on is secondary lymphedema. This is what happens when a totally normal, healthy lymphatic system gets damaged by some kind of external event. And this is by far the most common type. So, what kind of event are we talking about? What's the initial injury that kicks this whole cascade into motion? Let's take a look. In developed countries, the number one cause, hands down, is cancer treatment. Things like radiation or surgery. A huge one is the removal of lymph nodes under the arm during breast cancer treatment. That's a major, major trigger. But worldwide, you also see other causes like certain parasitic infections or just severe physical trauma to the body. Okay, but here's where it gets really interesting. If the damage happens, say, during a surgery, why doesn't the swelling start right away? Why does it sometimes take months, or in some cases even years, to show up? The answer tells us that the initial injury is really just the spark that lights a very long fuse. And that answer brings us right to the core mechanism of this whole disease. A nasty, self-perpetuating, vicious circle of fluid backup, inflammation, and tissue scarring. Right, so why is this chain reaction that's happening just under the surface, long after that initial injury? Let's break it down. This diagram shows it perfectly. So it all starts at the top with an injury that damages the lymphatic pipes. This means fluid can't drain properly, so it just sits there. It stagnates. Now, this stagnant fluid is like a constant alarm bell for your immune system, which kicks into high gear. But here's the twist. That immune response, instead of fixing things, causes fat to build up and that hard, scar-like fibrosis to form. And that fibrosis damages the lymphatic vessels even more, which makes the drainage even worse. And you see, around and around we go. It's a runaway feedback loop, where the body's attempt to fix the problem is actually the very thing that's fueling the disease. So you get it now, right? This isn't just a plumbing problem. It's really an immune system problem. Researchers have actually pinpointed specific immune cells, these CD4 plus T cells, as the main culprits driving this chronic inflammation. It's like they're the generals on the battlefield, but they're reading the map all wrong. Instead of resolving the issue, they keep the battle going, turning what could have been a temporary problem into a lifelong disease. For the longest time, all of this was happening invisibly. Doctors knew it was happening, but they couldn't see it. Well, not anymore.
Thanks to some incredible new imaging techniques, we can literally watch this vicious circle do its damage in real time.
Just look at the difference here. On the top, that's what you want to see, a healthy lymphatic vessel. It's like a clean, straight highway for fluid. Now look at the image on the bottom from an arm with early-stage lymphedema. The vessels are all swollen and irregular, and you see that cloudy, splashy pattern? That's called dermal backflow. That is literally dye leaking out of the overwhelmed vessels. The system is springing leaks right before our eyes. Now check out what happens as the disease really takes hold. In this image of late-stage lymphedema, the damage is just profound. Those clear, highway-like vessels, they're just gone, wiped out. All you see is this diffuse white haze, which means the fluid is just leaking out everywhere. The plumbing system has been totally wrecked by that chronic, runaway inflammation. But here's the really good news. Being able to see the problem this clearly is helping us develop some incredibly clever ways to fix it. So let's look at how science is finally starting to break this vicious cycle. The modern way to treat this isn't just one thing. It's a multi-pronged attack with a whole toolkit of strategies. You've got the basics, like compression therapy to manage the swelling. For more advanced cases, there's specialized surgery to remove the built-up fat and scar tissue. Then there's amazing microsurgery that can literally reroute or rebuild the broken plumbing. And the newest frontier? That's molecular therapy, actually designing drugs to calm down that runaway alarm system. This table gives you a snapshot of some of those really advanced surgical options. For example, a procedure called LVA creates these tiny little bypasses to get the fluid around a blockage. It's like building a detour on a highway. Or there's something even more amazing called VLNT, where surgeons actually transplant healthy lymph nodes into the damaged area to try and regrow the system. As you can see, they all have their pros and cons, which means doctors can tailor the treatment to the patient. But maybe the most exciting development of all is the move towards these molecular therapies. I mean, the ultimate goal here isn't just to manage the swelling and the fibrosis after the fact. It's to intervene directly at the source. The dream, the holy grail really, is to have a drug that can just calm that overactive immune response and stop the vicious circle dead in its tracks before permanent damage ever sets in. And all of this incredible research isn't just changing how we treat lymphedema, it's forcing us to completely reimagine the role of the entire lymphatic system in our health. And this brings us to the big takeaway. It turns out this isn't just about lymphedema anymore. Recent research has connected a poorly functioning lymphatic system to a list of diseases that is, honestly, it's staggering. We're talking about obesity, heart disease, IBD, even neurodegenerative diseases like Alzheimer's. This system we've ignored for so long is now emerging as a central player in our overall health. Which leaves us with one final, pretty mind-blowing thought. If we're just now discovering its connection to some of our biggest health challenges, what other secrets is this incredibly complex, vital, and still underappreciated system hiding in plain sight? It feels like the journey to really understand it is just getting started.